Hi all. Today we'll discuss about occupational English test. What is OET? There are lots of people have still doubt. Should I choose OET, IELTS, or PTE? There are lots of language proficiency tests are available. So we have still doubt which is best for us. If you are coming from healthcare sector or any professions from healthcare, nurses, doctors, pharmacists, dietitians, like that, OET is best for you because all our sub modules, the topics are coming from the healthcare basis, because we are handling with patients on daily basis. Daily we are talking to our patients, right? It's just that's it. This is easy for us to pass our OET and to reach our destination. If you are not sure where to start with your OET preparation, here I give you how to approach to each modules, each test modules, each parts, how to go, how you can tackle that areas. Now we have 4 modules: listening, reading, writing, and speaking. These are the 4 modules OET contains. And of course, listening module, listening approximately around 50 minutes, reading approximately around 60 minutes, writing 45 minutes. In this 45 minutes, the reading time will be 5 minutes and the writing time will be 40 minutes. And for speaking, 20 minutes, 10 minutes each. Okay, there will be 2 role play and the 10 minutes each. So we'll go to the listening content. Listening, it will be common to all professions. Okay, there won't be any difference. But you can see in the writing, it's completely depends on the each profession. If you are nurses, you can see your questions will come from the nurse. Like if you are a home healthcare nurse, if you are a community health nurse, like that. Okay, if you are a doctor, it will come by your name. If you are a physiotherapist, it will go to your profession. So this writing will be completely vary from your, not only writing, even the speaking. The writing and speaking completely vary from your professions. If you are a nurse, it's like that. If you're a doctor, it's like that. So but only the listening and reading, it will be common for all the professions. Okay, then in listening, what they are expecting from us, they are expecting whether we can able to follow and understand a range of health related spoken materials such as patient consultation and lectures. So in this listening, you can see one patient and our consultant both are talking. Okay, this is part A. I'm talking about part A. In this part A, there will be 2 recordings you can hear. The first they will play one doctor and one one of your patient is talking. So it's our responsibility is to listen well, whether we have a good listening capacity, what our patients and our doctors are communicating with us. That's what they are they want to assess from us, whether we are able to understand everything and whether we are able to understand what they are talking. Then from the reading, they want us to read and understand different types of text on health related subjects. Okay, so you can see even this one, we have part A, part B, and C. Part A, it's I think most of have little bit difficult on this part A, because part A reading, they want us to read and understand different types of text on healthcare related subjects. They will be give in part A, there will be 4 texts. Everyone is aware about these things, but I'm just simply telling to the one who is not aware. In part A, there will be 4 texts. We have just 15 minutes in this one, reading part A. We need to finish within 15 minutes. There will be multiple choice of questions like that. Part B and C, there will be some extracts. You need to read that extract and you need to answer accordingly. In writing, write a letter clear and accurate way that is relevant for the reader. Reading, they need us to very concise read. They doesn't want a very big story. They want us to concise and write the letter. In speaking, effectively communicate in a real life context through the use of role plays. They will be giving 2 role plays to us whether we are able to communicate effectively with our patient or not. This is just that, this speaking and all, it should not get never tough for us, because we are handling our patients on daily basis and we are talking to them. Maybe it's on our language, maybe you have still you are talking in English. Whenever you have getting time, you need to try to talk in English, at least in front of the mirror, so you will get familiar with the language and how to talk. So these all are the sub modules you need for the OET. Then we'll see how their grading is. Right, there are some grades, and everyone is aware we need B and C plus. C they are not accepting, and it depends on all countries. Okay, in Australia I think they need 4B. Ireland or UK and New Zealand, each countries have different according to their councils. Okay, so in A, if you are performing a very high level, you will get A. If you are performing if you are able to use English with fluency and accuracy adequate for professional needs, you will achieve B. C, good level of performance, however not acceptable to a range of health and medical councils. D, moderate level of performance requires improvement. E, lower level of performance requires considerable improvement.